Good morning. My name is Michael Specter, and I'm a staff writer at The New Yorker, and I'm very excited to be here today with Dr. Margaret Hamburg.
Thank you.
I'll start out with just the general question of how can one agency regulate what I think is a third of the American economy? I mean, how is it even possible? Does the structure of the FDA seem a little unwieldy to you?
Well, it is certainly true that the FDA has this vast range of responsibilities. You know, we regulate drugs, medical devices, foods, cosmetics, dietary supplements, animal feed, animal drugs. Now we actually regulate tobacco products as well. Many of the things that once were stovepiped and that, you know, still organizationally at FDA are somewhat stovepiped are increasingly interconnected. And so I think that there's real value in having this unique regulatory agency as a unified whole. You know, we are the only regulatory agency of its type, and we fulfill a very central mission. We're science-based, data-driven regulatory agency with a public health mission to promote and protect the health of the public.
It seems to me that you get pharmaceutical companies who are supposedly the bad guys of American life right now. They spend most of their money on marketing and repackaging drugs they've already sold, and partially they do that because if they make a new drug, and that new drug helps 31 million people and kills 7, somehow that equation is unacceptable. And it's this risk issue. How do you approach approving a drug when you know there's no question it's going to cause some harm somewhere, because everything does?
You know, one is that people do need to understand that there are risks in everything and that there is no drug that's absolutely safe. But I think we also can do a better job with assessing safety. And I think partly we can do a better job because science is evolving. And I think this is really a critical moment in time to pay attention to that. For one thing, we know a lot more now about the importance of monitoring drugs for safety once they're approved and in the marketplace. It used to really be viewed that the responsibility of the FDA more or less stopped when we approved a drug. Mm-hmm. But the truth is that the way drugs are tested, there's no way that you could expect to really understand the full spectrum of safety concerns associated with that drug until it goes out into the marketplace and is used not just in a very controlled environment as in the clinical studies that are required before approval, where at most there are a couple thousand people generally that are taking the drug, and people that are carefully selected for widespread use. Millions of people are taking the drug, and people that may have other underlying diseases, taking other drugs, et cetera, and you begin to get a much clearer picture about the safety profile of a drug. And so to be able to systematically and scientifically monitor what's going on in the real world and detect emerging safety signals and analyze them early on enables you to keep adjusting that risk-benefit balance.
You go into a health food store and you pick up a bottle. It has this wonderful label that says, this is, I can't remember it exactly, but it's basically, this has not been approved to cure, treat, or do anything else involving a particular disease by the FDA, which is nice. But it makes you question what those things do. So for a consumer to go in and maybe want to improve their health, and they look at this, you know, antioxidant thing, and it's got all these claims, and they're very sophisticated claims because there are certain things that are against the law. You can't say something treats a disease. You can't say something cures a disease. But you can say lots of stuff that is confusing, because I get confused every time I think about it. Will that ever change? Can that change?
Many people assume that FDA approves these dietary supplements, but as you point out, if you read the bottles, you know, we don't. And there's been, you know, back and forth debate about whether we should be more involved in that process. You know, my attitude is that, you know, these are things that the American public, you know, really does want and use. I think that there isn't a full appreciation of the level of regulation and oversight, and I think consumers, you know, should be aware. And I think that we need to continue to really use the authorities we have to monitor more aggressively and respond when problems emerge, and use that also as continuing education, and work with the dietary supplement industry. And the major players recognize that when there are problems and deliberate adulterations are the worst, that it damages, their brands. So this is certainly an area that we're working hard in, and we've been, pretty active over the last year and a half.
More and more you see studies that show that a certain vitamin interacts with a certain medicine in a way that makes it problematic at best. Many studies that show just taking certain vitamins increase your chances of certain types of cancer. How much of a responsibility does the FDA and does the government itself have to sort of steer people away from their obsession with this and say, listen, people, this data exists. I mean, it's in the papers. You guys don't run from it. It's just that somehow it doesn't ever get home to people.
Well, communicating information about science and advances in medicine has long been a challenge. It's been a challenge in educating the public. It's been a challenge in educating healthcare providers. I mean, there often are advances that really make a difference to people that take a very long time to get into the practice of medicine. The other thing is the complexity of understanding science. And, we all want to believe that we are making the best possible science-driven decisions, yet science is always evolving and changing, and also you can generally find studies to support whatever point of view you have.
You can.
So, being really rigorous about the science, the quality of the data, and the willingness to look at all the different studies, but at the end, really scrutinize and scrub is critical to the work we do at FDA.
You guys have been quite active. I think your desire is to make food labels coherent. I'm wondering how possible that is. It seems to me that food labels are, more than anything else right now, a marketing device for companies. What do you put on a label? How do you make this happen? Should we just have labels that tell us what's bad and not what's good?
It's not a completely easy discussion, and we have certainly had the experience over the last year and a half or whatever since I've been FDA commissioner of having to ask companies to stop doing certain things that we felt were in fact misleading. I think the most sort of obvious example of our concerns came through a program that was called the Smart Choice Program, where a lot of companies got together and they, I think in a very, very serious way, tried to put together an algorithm that would enable foods to be rated, and if all the different factors about the different nutrient attributes of your product added up to a certain number, you'd get this green Smart Choice check. But when Frosted Flakes, got that, it was really going a step too far, and a few other things like that, and claims that Cocoa Puffs will boost your immunity and other things, So, but there actually was a time when cereal boxes didn't have any advertising or claims on the front.
Genetically modified foods are issues that drive people crazy and anger many people. It's very difficult on a scientific level for me to argue against the data, and the data seems pretty clear. There isn't a danger. But there's a bigger issue here, and we run into it all the time, which is a fear of where we're moving.
Well, I think, it brings us back to what we've touched on multiple times already this morning, which is the importance of educating the public about issues of science. I mean, genetic modification of foods, of course, has gone on from, the very beginning of time. The technology has changed somewhat, but it's not as frightening a concept, and there's, an enormous body of evidence about the safety of genetically modified foods that are in use today and making a difference, and certainly not only making a difference in terms of the quality and taste and availability of foods in this country, but also making a difference in terms of extending food options in the developing world by making hardier plants and seeds. I think all of this speaks to another important issue that is always on our plate at the FDA, which is the fact that in the modern era, science is evolving more rapidly than our ability as a society to cope with some of the innovations, and our ability as an agency and as a scientific community always to assess some of the safety concerns. And for me, what this speaks to is a need to really strengthen our systems to address those concerns. And it's why, for me, the FDA plays this very important and unique role, because we need, whether it's genetically modified foods or nanotechnology or synthetic biology, we need to be really at the forefront of asking and answering those important questions about safety. And many of them are not easy. Many of them are straightforward, but explaining them is more complex.
So now I want to move into an area that I know you are delighted to talk about in public, which is personal genomics. By personal genomics, I mean the revolution in how we look at medical testing, for one. And there are a bunch of tests now that will tell you what your genetic predisposition is to any number of traits, diseases, proclivities. And there's been a lot of controversy because there's a feeling that maybe that we're getting ahead of ourselves, that we're giving people information that they ought not to have or don't know how to deal with.
Well, I think you're focusing in on a small aspect of what is a much bigger set of questions and a very important issue, which is that we are sort of on the cusp of the era of personalized medicine and the ability to use all of the scientific research and new insights that come from being able to sequence the human genome and the genome of various living organisms and biological entities, and that can dramatically inform how we practice medicine and treat disease, how we develop new drugs and diagnostics, and ultimately, offers huge promise for prevention, for new treatments, and for cures. We need to change how we do a lot of things in that context, including, how we do clinical trials, because we need to really understand that some drugs may work better for certain people that have certain genetic traits. The genetic test and the quality of that test is critically important for decision making. You've just been railing against claims that aren't backed up by solid science in another context. I think it would be equally irresponsible of the FDA to allow genetic tests that may be the basis of significant medical decisions and actions, significant changes in lifestyle, not to also undergo review to make sure that the tests actually do what they claim to do. There's no question that these tests are medical devices under the framework of the law. They're diagnostics. And we I think have a clear responsibility to make sure that the science that underlies those tests is high quality, that the tests do what they claim to do, and also that claims are based on data and good science.
George Church, who teaches at Harvard, and we both know him as a geneticist and a very important one, he has this quasi-scientific fictional fantasy that I don't think is that unlikely, that not so long from now you'll go into whatever store you want to go into and you'll take your iPhone or your Android phone or whatever out and point it at something and it will say you shouldn't be getting this because your cholesterol is too high. You already had 2 eggs this week. You can have that steak because you have no problem. Why didn't you buy the baby aspirin? Because you should be taking one of those. These things seem very Big Brother-ish, and they are, in a way. They can also be very helpful, but they all do require some sort of sense from the consumer that what they're seeing and what they're getting is real. And that is, I'm afraid, where you come in. It makes it an even broader job than the one you have now, if that's even possible.
Well, you know, the world is getting really complex, and all, you know, the sort of traditional lines are starting to blur a little bit, and you know, it's a lot of challenges before us. I hope I'm not FDA commissioner when I have to, when this new device comes up for approval that tells you everything that you need to do. But I think that the critical point, you know, here, I think, is that FDA is not trying to stand in the way of innovation, is not trying to stand in the way of application of advances in genomic science to the practice of medicine and to improving health. But what we want to do is make sure that just as in, you know, so many other realms of medical practice, that devices that are being used as the basis for medical decision making are subject to regulatory oversight and, you know, some kind of scrutiny to make sure that they actually are what they claim to be. There was a very disturbing GAO study that you probably know about, the Government Accountability Office, I guess it is. They were interested in this question about genetic tests, and these direct-to-consumer companies, they gave samples from a set of people to 4 different companies and got back very, very different answers and recommendations. So it tells you that there's work to be done scientifically, and there's work to be done in terms of assuring the validity of tests and the claims being made. Well,
on that note, I'd like to say we're very lucky to have you doing this. I don't know why on earth you do it, but it's, in your year and a half, you've been remarkably successful, and I can only imagine that you're 1/10 of the way where you want to be. So for the New York Occurrence, I want to thank you very much for this conversation.
Thank you. It's been fun.